Hi everyone, I am Ali Gomti with you. Today we will start our new session Basic ECG. There are 5 steps to remember in a normal ECG. The first one is heart rate. That means the rate of the ECG normal sinus rhythm should be between 60 to 100 beats per minute. That means heart rate should be between 60 to 100 beats per minute in a normal ECG. So, if anything less than 60, it's called bradycardia. Anything more than 100, it's called tachycardia. So, the rate should be between 60 to 100 beats per minute. Then, next is the rhythm. Rhythm should be regular. What's the rhythm should be regular? That means 2R wave, between the 2R wave, the interval should be normal. That means 2 peaks of the R should be evenly spaced. So, RR interval should be normal. In an ECG, if you see an ECG, between the 2R wave, the interval should be normal in a rhythm. That's called a normal sinus rhythm. So, in a normal ECG, the rhythm should be regular. Okay, now we understood first is heart rate, second is rhythm. Now coming to the third one is the P wave. What is P wave? In a normal ECG, you can see the complex should be P wave, QRS and T wave. So, the third one is P wave. Normal ECG, the P wave is called atrial contraction. What is atrial contraction? Atrial contraction is squeezing of the atria. That is called atrial depolarization. So, atrial depolarization time, the P wave should be upright in a normal ECG, the normal conduction system. Also, the P to R interval, so that is the starting of P to the starting of QRS. So, the PR interval should be normal. PR interval is, it should be 0.12 to 0.2 seconds. That means it should be less than 5 small square. 1 small square is 0.04 second. So it should be less than 5 small square. P wave should be upright and PR interval should be between 0.12 to 0.2 second in an ECG step. So this is P wave. Now, next is the fourth one is QRS complex. What is QRS complex? QRS complex means first atria will contract, that is P wave, that time ventricles will relax. But when the QRS complex occurs, ventricular depolarization is happening. Ventricle will squeeze in this time and the blood will pass from ventricle to the aorta to the whole body. So, the QRS complex should be less than 3 small squares. QRS complex should be less than 3 small squares. And Q is this one, R and S. So, this is QRS complex and ventricular depolarization is happening in the ventricle. And next one is T wave. T wave is the ventricular deep repolarization. So, this is T wave. Repolarization means relaxation of the ventricle. So, these are the 5 steps to remember in a. So, at the end, we will summarize what we have discussed. Heart rate in a normal ECG, the rate should be between 60 to 100 beats per minute. Anything less than 60 is bradycardia, anything more than 100 is tachycardia. The next is the rhythm. The rhythm should be regular. That means RR interval should be normal. Third is P wave. P wave should be upright and the PR interval should be between 0.12 to 0.2 seconds. That means it is less than 5 small squares in an ECG strip. The fourth one is QRS complex. QRS complex should be less than 3 small squares. Then following of QRS, it should be T wave. The amplitude of the T wave should be lower than the QRS complex. Thank you for watching Basic ECG.